Nancy?
Yeah.
Where's Sarah?
I have no idea.
Yeah, me neither. Anyway, well, today's a special day on the show. We have our first special guest, and this is Nancy Roberts. And Nancy, tell us what your position is and what you do, and how you're all tied into this whole thing.
I'm a nurse. I work at Spectrum Health Hospital, and I am the nurse coordinator for our postpartum emotional support program.
So you have a lot of experience working with families dealing with postpartum depression and other perinatal mood disorders?
Yes, I've been doing this since about 1993 when we started our support group there, and it's still running strong. So.
Great. Well, the reason that we're swimming across the lake is to raise awareness of perinatal mood disorders. So we thought that today it would be great to kind of get some insight into what they are, signs and symptoms, how you can get some help, all that kind of stuff, and that's what I think we're going to talk about today.
Great.
So, where should we start?
Any place you want.
Well, let's talk about signs and symptoms and how people can recognize that they might have some perinatal mood disorder.
Okay. Signs and symptoms. Sometimes it even starts in pregnancy. So please be aware that if signs and symptoms begin during the pregnancy, that's a flag, just to make certain that if help is not initiated during the pregnancy, that we do some good screening and provide, that mom, with additional services after she has her baby. So that's one red flag. Certainly at delivery, and I work in the hospital on the postpartum unit, we're always screening our moms after delivery, making sure that our moms that have risk factors are well educated. We want to make sure everybody knows what to look for, what the signs and symptoms are, and certainly if they were to notice they had signs and symptoms, we want them to know what to do, what the resources are, and what's available in our community here to get our moms the help that they need and deserve. So signs and symptoms look like sometimes it's depression, sadness, blues, crying. And sometimes, though, it may look like anxiety, more speeded up, anxious, worrying all the time, racing thoughts, can't sleep at night because of that panicky, overwhelming feeling. Mm-hmm. And then thirdly, sometimes it looks like irritability, just mad, kind of anger, short temper, short fuse. There's really no right or wrong. It presents different ways for different moms. And I think it's just important that we know that if something doesn't quite feel right, whatever it might be, just go with your instinct and jump right in there and talk to your doctor, get some help, that sort of thing, and access the resources that we have in West Michigan.
Awesome. Now, what kind of things can doctors, nurses do to sort of help identify some of these symptoms? Are there tests? Are there, what are ways that they can do to try to help determine whether it's just maybe some normal anxiety about having a baby versus something that might be, in fact, more serious?
Right. Well, there are some questionnaires that a lot of the doctors here in Grand Rapids will have their moms fill out at the 6-week checkup when they come in after the baby's born. It's called the Edinburgh Postnatal Depression Scale. It's 10 questions. Just simply ask her how she has felt in the last 7 days. And there's a scoring system, and a lot of the doctors will be screening, our moms at the 6-week checkup. In absence of a tool or a questionnaire, just having some key questions, to ask mom. Things like, how are you doing? How are you doing really? That kind of thing. Are you sleeping okay when the baby sleeps? Are you eating okay? What's your appetite like? What's your day look like at home? Are you anxious for no real reason? Are you feeling sad and blue? Do you cry easily? Is it just something that happens occasionally? Or if we're seeing that things are happening as far as signs and symptoms on a daily basis, that's a flag. Go ahead and get some help because it's probably not normal. And there's different severities, mild, moderate, severe, but certainly if it's a daily basis, it's time to get some help.
Right on. So someone then, maybe they see their doctor and they say, look, it really seems like you have some sort of perinatal mood disorder. How can people get through it? What are tips, techniques? What are ways that you can get through this difficult time?
Okay. Well, there's a variety of different like treatment options. Okay, number one, self-care. Number two, sometimes medication helps, and sometimes number three, more the psychotherapy or the counseling piece of it. So let's talk first about self-care. It's really important that we really focus on good self-care on a daily basis. Maybe she's not sleeping well, so let's make sleep the priority. Let's make sure she gathers the people around her, making sure that everybody's on board, and affording her now more opportunity to take naps during the day when the baby's napping, or even help at night during feeding, with feedings, and when she's up during the night with babies. So, sometimes it's just a little bit more sleep each day can make a big, big difference.
Yeah, definitely.
Yeah. And then eating, just making sure she's eating a good nutritious diet, making sure she's avoiding a lot of caffeine and sugar, because a lot of our moms kind of live on caffeine and sugar because they got to get up and get going in the morning and they don't have time to eat, and then an hour later they're crashing because it's so short acting, the caffeine and the sugar. So I really stress to the moms that they've got to be eating high protein rich foods, at each meal, plus like protein snacks between the meals. So that's easy if you think in terms of maybe a glass of milk or a piece of cheese or a yogurt or a handful of nuts of any sort or peanut butter or protein bar. Those kinds of things are really good, healthy snacks. Taking vitamins, making sure she's taking the prenatal vitamin postpartum during that first full year. Yeah, and if she wants to take a supplement, we usually recommend the omega-3 fatty acid fish oil supplements, at least 1 gram a day there, and sometimes the vitamin K. Vitamin D for lack of sunlight, especially here in Michigan. We really want to make sure that moms are taking, the supplements and the vitamins that are really necessary for her that first year. Also help. She needs help around the house. Sometimes, just having an extra person come into the house and just helping with some chores and tasks and helping with other children if she's got other kids makes a big difference. So, if she can enlist the help of family, friends, or even a school-age girl after school to come into the house and just do some light chores and rock the baby or whatever, it gives her a break.
Yeah, some of those simple things, doing a load of laundry can really just take a load off of someone's mind. You just feel like, okay, something else is done.
Yes.
I don't have to worry about it.
Exactly.
So, yeah, that's good. That's great stuff.
And then just finding somebody, like a trusting person to talk to. I think that's in confidence. Someone, whether it's a mother, a sister, a friend, a neighbor, husband, whoever it is that really understands, because they think, number one, education is huge. The whole family, everybody around here needs to know what we're dealing with. It's like when you were if you were diagnosed with diabetes, of course you want to be educated on foods and insulin and that sort of thing. Same thing with this. If you've got a diagnosis of postpartum depression, or you kind of think maybe that's what's going on, it's really important to gather your forces. Make sure everyone's aware. Do some reading. We have some really good literature that we give to all of our moms at Spectrum Health as far as education is concerned. There's good books out there. There really is a lot of information.
Yeah, no, there is. And it's nice because, over the years, I know even when our kids were born, they weren't even really screening for postpartum depression or anything related. So it's really nice to see that there's, support in the community, and it's really great to see all that stuff going on.
Oh, yeah.
Now, tell me, I know there's probably not a direct answer for this, but how long does it take people typically to get through some of these types of issues that they're dealing with? And I realize that could range greatly, but there must be some averages for getting through this type of thing.
I think the key is the sooner you identify that something's not quite right, the sooner you get help, whether it's self-help, whether it's medication, or whether it's counseling, the sooner you put all that together in a nice little package for treatment, the sooner you're going to feel better. So if you put it on the back burner, don't address it for a month, that's one additional month that you're not going to be improving. So I think the key is early identification, and then jump in there with both feet. Call your doctor, have a conversation about medication options. Not all moms use medication, or maybe it's not indicated, but certainly it's a good conversation with your physician, whether it's warranted or not. And a lot of moms will say, can I take medication and breastfeed? Absolutely. There are safe medications that are available to use while breastfeeding. There are safe medications that can be used during pregnancy too. So again, talking with your doctor about that risk-benefit ratio is really important. And then as far as the counseling piece of it, we have a whole team of counselors and therapists that all specialize in postpartum depression, and so we can help make that referral and make certain that she jump right in there with some counseling too. And sometimes that involves bringing dad in too, and sometimes even other family members. So, and that's a possibility.
All right, great.
So the sooner you get help, the sooner it's going to go away.
Great.
Okay?
Really good information.
That's the rule of thumb.
Yeah, no, very good to know. Well, I really appreciate you being here today. This was great. I think we learned there's a lot of great stuff that we can share with our viewers, and hopefully they'll take away some good information. And if they need to get help, you can definitely contact us and contact Nancy directly. We can post some of that information online.
Sure.
And you do know that if you sit on the couch, you have to swim.
Oh no!
You do know that.
In a pool maybe, but not Lake Michigan.
You can swim 50 miles in a pool? That's actually harder. I think that would be hard. Well, anyway, thanks again for being here, Nancy, and thanks everyone for hanging out, and we will see you next week.
Thank you.